Information technology is becoming more and more important in the healthcare world, and also more complex. Clinical informaticians transform healthcare by designing and evaluating information and communication systems that enhance individual and population health outcomes and improve patient care. Dr. Pele Yu is the director of the UAMS Clinical Informatics Fellowship Program and will tell us more about this study and why you should know about it. This is UAMS Health Talk, the podcast from the University of Arkansas for Medical Sciences. I'm Caitlin White. So, Dr. Yu, for those of us who are first hearing about the in-depth technical side of things, what is clinical informatics?
Clinical informatics is the application of computer science and health information technology to improve the healthcare services and the quality and safety of care. Clinical informatics is also beneficial to improve medicine by increasing the availability of clinical data that can be used for research and medical discoveries. Medical subspecialty was born in 2013, so we became a formal medical subspecialty. So since then, we have had medical subspecialty fellowship training programs all over the country, and right now there are about over 40, fellowship programs training future physicians to become clinical informaticians. The reason why this field is very important is because if you look at the benefits, right, of information technology in our lives. In our personal lives, we, have the internet and the availability of information, that helps us in our day-to-day lives, and how information technology has helped other industries, the manufacturing industry, the publishing industry, almost everything, like music industry, right? Healthcare is having similar transformation. And we're a bit behind, compared to our colleagues in the other industry, but it's beginning to shape up. So if you look at the way the computer systems in hospitals that support transactions and care, if you go back, let's say early 2000, there's about maybe less than 20% of hospitals in the United States that have computer systems. We call them clinical or electronic health records. There's about less than 20% of hospitals in the nation that have electronic health records that actually help physicians make decisions, clinicians, people from the hospital, the physician's practices. But today, almost 100%, close to 100%, maybe 96, 98% of hospitals in the United States have adopted a more mature type of electronic health record where it helps physicians care for patients in a more robust way. And about 86, 88% of physician practices in our nation, right, have computer systems or robust electronic health records that actually support the care and delivery of care in those sites. So just imagine then across the nation, you have almost 100% penetration of smarter information systems that allow people to take care of patients through information technology. So if you look at the manufacturing industry and the banking industry, there's almost 100% penetration, right? Because we use that to track transactions and all that stuff. So similarly, that's what's working in healthcare. So I'd like to point out that the technology is different than the medical technology because, in healthcare, the medical technology is just really up to the state of the art, right? We have MRI, CT scans, those kinds of things. So this one, we're talking about the information technology. So these are clinical information systems that help care team members in the hospital take care of patients using the computer systems. So we're talking about clinical decision support. We're talking about alert and reminder systems to help them improve care and then deliver the medications on time, et cetera. So those are the things that clinical information systems or electronic health records help improve the care that's being delivered in our health system.
So you say this has been going on since 2013, about 9 years now, but as a layperson, it's not, top of mind for me. So how does it improve my healthcare experience?
The clinical informatics medical subspecialty started in 2013 as a formal specialty in medicine, right? Similarly to like your cardiologist or nephrologist or gastroenterologist. Clinical informaticians are also that type of subspecialists. We are that type of subspecialist. So how these types of specialty help improve care is the clinical informaticians, that's how we call them, help improve, maintain, build, and optimize the clinical information systems that are being supported in the clinical setting. So in our day-to-day lives, we work with physicians, we work with nurses, we work with IS people, we work with administrative people to help improve the computer systems in the hospital so that then when physicians and nurses take care of the patients, the computer systems allow them to make their workflow more efficient and then have the information available right in front of them so that then they can take care of the patients better. Our healthcare system is so complex now that sometimes you need an information support to help you make better decisions. Did I miss anything? Are the immunizations up to date? Are the lab results there? Are the X-ray images, available already? How do you make those set of information available at the point of care for the care team so that then they can take care of you as a patient, so we don't miss anything. So developing the reminder systems, we call it clinical decision support. We help build those tools. Now, the advantage of clinical informaticians is that they are, primarily physicians, right? So they know inherently, how medicine works, how patients are being cared for, because they do see patients as well. Like for me, I also see patients. So, and in addition to that, we have specialized training in information technology, data science, informatics, so that then we're able to translate those healthcare needs, right, in the workflow, patient care needs, into computer speak. And vice versa, we're able to help the computer technologists, right, the information systems people, the IT, we're able to translate the IT components into clinical language because inherently we're clinicians. And so the colleagues that we work with also understand, how to use the system well, how to leverage the best tools available, because computer systems are upgraded every single time, right? So as we modernize the information systems, those have ramifications in how we do things. So like if your iPhone is updated, there's new way of doing things, right? And we have to be able to translate that clinically so that then the clinician would say, oh, okay, well, there's now new ways of ordering Tylenol, and here's how I'm going to do it. Or here's a new way now of ordering the medications or ordering the tests, the lab test, and that is going to be represented in the computer systems.
And while informatics is important to this direct patient care, I understand this is also helpful with research. Can you tell us more about that?
So in the past, when we do research, we collect them manually. If I want to do research on, let's say, asthma for patients, we collect the information manually, we ask questions, and we put them on paper, and then when we analyze the results, we transform them, into a computable, format so that we can analyze them, right? So that we can calculate the things. So the collection tended to be manual in the past, and that's because everything is manual. Like if you look at the movies in the 1980s, doctors, nurses, and all that, we carry a chart, right, in our hands. But now, a lot of those information, remember I told you about the almost 100% penetration of computers, mature clinical information systems in the healthcare setting. So almost 100% right, for the hospitals. So think about those, almost all the transactions, the things that are happening to the patient, right? The tests that are being ordered, the results that are being retrieved, the notes that we write about the patients, the diagnosis that we find across the patient population, the services that we provide, the readings, the monitoring systems of the patient, they're all in a computer format. So then what that does is that instead of having the manual collection of those data points, right, you leverage the computer to pull that information. So then instead of manually entering them, they are now entered as a byproduct of what we do about a career. So that makes research more efficient. That still is an opportunity, an ongoing opportunity for now, because not all research variables are incorporated in the electronic health records, but it's growing over time. And one of the opportunities for clinical informaticians like me is to develop the process and mechanisms so that then those research variables are now made computable, meaning that they are captured in an electronic format, digitized format, and incorporated in the computer so that then you can then use computer technology, right, to review, retrieve, analyze those set of information. So where this really leads over time is that you would then increase the availability of data that people can use for research. And so it's really, really a fascinating thing. If you look at our personal lives, we're capturing a lot of the information about our health in our personal lives. Similarly, in the care environment, we're beginning to capture a lot of data about your health so that then we could leverage those, of course, with proper privacy and confidentiality and respect for your ability to share your data. So by having information available in a computable or digitized format, we're making it readily available for research to happen because they are now stored in a computer format.
Great. Well, so much good information here, Dr. Yu. Thank you so much for joining us today. That was Dr. Pele Yu, the director of the UAMS Clinical Informatics Fellowship Program. For more information, visit uamshealth.com. And thank you for listening today. This has been UAMS Health Talk, the podcast from the University of Arkansas for Medical Sciences. I'm Caitlin White. Stay well.